I'm Martin McKee, and I'm co-director of the European Observatory, and I'm joined today by my colleague Erica Richardson, also from the Observatory. And we're going to be talking about information, disinformation, misinformation, and trust. Now, we know that we're living in an age where information is traveling faster than ever before. So the challenge of distinguishing fact from fiction has become increasingly complex. Nowhere is this more evident than in the realm of healthcare, where disinformation ranging from misleading claims about treatments to outright fabrication about medical leaders and institutions is threatening public trust in health systems. Trust is the foundation of effective healthcare. It influences everything from patient adherence to medical advice to the success of public health initiatives. Yet as misinformation and disinformation spread through social media, political utterances, and a wide range of unverified sources, this trust is eroding. If we are to safeguard the integrity of healthcare, we have to build and secure trust in health systems. Now, one of the most pressing reasons for strengthening trust in health systems is the impact of disinformation on public health outcomes. When people are exposed to misleading or false health information, they make decisions that put themselves and others at risk. We've all seen how the spread of anti-vaccine narratives has led to the resurgence of preventable diseases. Similarly, during the COVID pandemic, misinformation about ineffective treatments and vaccine safety led to vaccine hesitancy and prolonged the crisis and increased deaths. Without trust in health systems, misinformation and disinformation flourish, undermining efforts to control diseases and protect publications. But it's more than that, because beyond individual health choices, trust in health systems is essential for societal resilience. A well-functioning healthcare system depends on cooperation between healthcare providers, patients, and public health officials. And when people distrust their healthcare institutions, they're less likely to seek care when needed, leading to delayed diagnosis, worsening health, and increasing strain on emergency systems. In contrast, societies that foster trust in healthcare systems experience higher rates of preventive care, better health outcomes, and more efficient use of medical resources. And obviously, this is all encouraged by the spread of by the increase in the use of the digital world in which we are all now living, where unverified claims can go viral within minutes. The challenges that we face then are multiple. Not only must health institutions provide accurate and transparent information, but increasingly we're seeing how we need to counteract the misinformation and the disinformation that erodes public confidence. So today we're going to discuss these issues. We're drawing in particular on a new book that we in the European Observatory have published, and my colleague Rachel Greenley will start off by discussing what we wrote and its implications for policies. Then we'll hear from Svitlana Nidzvetska from Ukraine, who will describe how they have dealt with these issues in an extremely challenging situation. We'll then hear from my colleague Sheena Cruickshank, who is a world-leading immunologist, but also a professor of public engagement with science. And even more importantly, she's a colleague with me on Independent Sage, an initiative in the UK that engaged with the public throughout the pandemic. And finally, this will all be brought together by our discussant, Yuxi Wang, who has led on several papers on disinformation, including a seminal systematic review. As I've mentioned, we'll have in the background my Observatory colleague, Erica Richardson, who will be monitoring your comments and questions that we will all respond to at the end. So over to you, Rachel. And Rachel is a research fellow at the London School of Hygiene and Tropical Medicine, and someone who I've had the enormous privilege of working closely with for several years. Rachel, over to you.
Welcome, everyone, and say thank you for this opportunity to briefly present our work from the book Trust, the Foundation of Health Systems. And I'm speaking on behalf of the author team, as our work was developed through collaboration with the London School of Hygiene and Tropical Medicine, WHO Regional Office for Europe, and the European Observatory on Health Systems and Policies. Now, this book was originally conceived as a working document to inform a WHO European Region conference held in December of 2023. And this was on the theme of trust and transformation in health systems. And it took its starting point from the COVID-19 pandemic. And in particular, it gained insights from the Pan-European Commission on Health and Sustainable Development. So our focus is primarily on the WHO European region, but a lot of examples in literature is also drawn from other countries. that are also relevant. So working on the conference document, we quickly realized there was a lot to unpack on trust. And after sifting through the literature and speaking with some experts, the end result brings you a multidisciplinary framing into why trust matters in the health system, how it is built, and how it can be sustained. And I think for many of us, before COVID-19, it was easier to imagine a world where health systems were well designed, where the right clinicians with the right tools were likely to be in the right place at the right time, where citizens could trust their governments to provide the care that they need, and politicians felt more confident that the resources they allocated were used efficiently. This vision has since been shattered, and now largely remains aspirational. So this primed us to really sit with the question, what happens when people stop trusting their health system? And in a number of ways, the answer is unfolding before our eyes. It looks like vaccine refusals, as Martin had mentioned. It looks like hospitals overwhelmed by preventable diseases. It looks like rising distrust in health authorities, political leaders, and medical science itself. In the book, we discuss the People's Voice Survey, where a novel population survey in 15 countries measured population confidence in health systems. And they found that people felt very health insecure, and that more than half were not confident that they could access and afford good quality care if they felt sick. And so what this meant is that when people don't trust the system, they don't use it. And so this book does a lot of things, but it does not define trust definitively, as trust is a complex and evolving concept, nor does it cover all trust relationships in health systems. Instead, it focuses on social trust, that is through patients, health workers, policymakers, while also acknowledging institutional trust in health authorities, regulations, and government. It does not prescribe specific trust-building policies, but emphasizes the need for context-specific strategies and lays out what some of those could look like. So through this book, we seek to actually ask a series of questions. Why is trust important for health systems, and how does it impact their functioning? How do different types of trust and specific trust relationships affect the health system? How do different disciplinary perspectives enhance our understanding of what that trust is? And how does trust interact with tech, AI, and other data systems? And then finally, where does policy fit? And what are the implications for building and sustaining trust in health systems, and what needs to be done in the future? So it was important for us to start with why trust matters in the health system. And as we've mentioned, health systems are built on relationships and between patients and doctors, healthcare workers and policymakers, government and the public. And these relationships function on trust and trustworthiness. And you can see here in the diagram that we don't seek to answer or to look at all of the relationships that can potentially happen in a health system, but we map out some of the more forward-focused ones. So without this trust, we've noticed that patients hesitate to seek care or follow medical advice. Health disparities are exacerbated and health outcomes worsened. And we've seen health workers disengage, leading to burnout and workforce shortages, and governments to really struggle to implement reforms. In contrast, as Martin mentioned, high trust health systems have been shown to have better healthcare engagement, better patient outcomes, and improved preventative care uptake. So this trust improves policy compliance and sustainable investment in healthcare, and this is undisputable. But we asked, what makes for a high trust health system then, if we're not seeing it everywhere? And trustworthiness was a key characteristic that came up in a well-performing system. But this is something that's built up over time and can't be assumed. There is a place for mistrust of the health system. It can help to expose systems that are unsafe, prejudiced, lacking appropriate resources. But it's important to be asking them these questions that this book seeks to find out, and not just blindly conferring trust or trustworthiness. And this is important for advancement in health systems. If the public is to regain and retain trust in the health system, they must be confident that the system can meet their needs now and in the future. So trust in trustworthy health institution determines whether policies succeed or fail. And it's no surprise that the COVID-19 pandemic exposed the fragility of trust in healthcare. While some countries leveraged the crisis to innovate, others faltered due to overburdened hospitals, vaccine skepticism, and political infighting. And we saw a lot of what the pandemic did was heighten distrust, particularly in health information. And this was concerns over misinformation and disinformation, which much of what we'll speak about today. There was also concerns over data security, equity and fairness. And so we've come to see that trust has become a finite resource, one that is easily lost and difficult to rebuild. And today that trust continues to erode, and disinformation and misinformation are accelerating that decline. So the erosion of trust in health systems is not an accident. It is being fueled. And first, I think it's important to clarify the terms between misinformation and disinformation. With misinformation is the accidental spread of false or misleading information, whereas disinformation is deliberate. It's crafted and deployed to deceive, often for political or commercially motivated financial gain. But today, both are thriving. Let's consider vaccine hesitancy. A few decades ago, childhood vaccines were an unquestioned public good. But today, vaccine refusal, fueled by viral misinformation, has led to the resurgence of measles, polio, and other preventable diseases. And so we saw during COVID-19 that we saw this play out on a global scale. Countries with high trust in health institutions had better compliance with vaccine rates, they had lower mortality rate, and faster economic recovery. Meanwhile, places where trust was low, where governments potentially ignored scientific evidence, they were faced with higher mortality and public backlash. And this is also where misinformation flourished. Conspiracy theories took hold, and people actively rejected life-saving interventions. But this is not an isolated event. So we asked, why did this happen? And some of what we outline in the book is that there are a few things at play. Social media algorithms reward engagement, not accuracy, and tend to function with false narratives going viral. AI, we know, to be riddled with falsehoods. It operates faster than fact checkers can correct them. And bad actors, from political operatives to corporate interests, are weaponizing disinformation to sow doubt in science. And of course, there's the challenge of balancing regulation with freedom of expression. So needless to say, this is a warning sign for the future. And the question is, what can we do differently next time? So while there's no single solution to building trust, we do know what works. And trust is built on transparency, consistency, and accountability. And in our book, we identify 3 pillars. Those include innovate and invest. And building trust requires each of these pillars with inclusion of addressing social determinants of health, reducing inequities, and ensuring universal access to care. And some of the strategies that we outline and take note of were through the use of co-production models. And these models were used to engage communities in designing policies, ensuring perspectives were shaping healthcare solutions rather than just witnessing them, and particularly in communities with historical discrimination. Through some of these co-creation and co-production efforts, there needs to be more transparency initiatives, and that's been seen through citizen assemblies that involve decisions through public and fosters accountability, and with inclusive health communication, which we'll speak about later. Trust is also built when health systems embrace flexibility and innovation while prioritizing ethics and equity. And so the innovation strategies include tech-enabled healthcare solutions that empower patients and providers, improving accessibility and efficiency. We also noticed that AI governance frameworks could balance rapid innovation with ethical safeguards, and that misinformation detection systems driven by AI can be used to combat false health narratives and reinforce evidence-based decision-making. But trust in health system depends on investing in people. It also depends on recruiting and training healthcare professionals with improved working condition. It also depends on sustaining funding for public health initiatives that reinforce trust, and that there needs to be accountability for misinformation. So while some of these seem pretty straightforward and not reinventing the wheel, we also need to recognize that we can't fight 21st century disinformation with 20th century tools. And so there needs to be a commitment to monitoring, research, and regulation in these areas that are rapidly advancing. So it leads me to my final slide and just some key messages, and not all of the messages, so please feel free to go and read the book and find out more. But trust is vital to the functioning and sustainability of health systems. People need to trust that their health system can and will care for them, and the healthcare workforce needs to trust that the system will enable them to provide this care. Trust can't be taken for granted, as it's hard to build, easily eroded, and is challenging to measure. Health systems need to be both trustworthy and trusted by everyone of all ages and backgrounds. And this is a nice to have, or sorry, this is not a nice to have, it's essential. And there are specific strategies for strengthening trust. So I just wanted to thank everybody again for this brief overview of the book, and a big thank you to my co-authors, Dr. May van Schvelvik and Dr. Govind Permanent, and of course, Martin McKee. Thank you.
Rachel, thank you very much indeed. And can I just encourage everybody, I know some of you already are putting your questions and comments in the chat. And among them, I have to say, I was delighted to see Felix Gill, who has written a great deal on trust. And in fact, we cite his work very prominently in the book. So do keep them coming, and Erica will pull them together at the end, and we will try to respond to them. So it's now a huge pleasure to introduce Svitlana Nidzvetska, who is from Kyiv Mohila Academy in Kyiv, so talking to us from Ukraine. And Svitlana is a program officer at the Global Fund to Fight AIDS, TB and Malaria, and visiting university lecturer at the Kyiv Mohila Academy, who specializes in maternal and child health and the monitoring and evaluation of aid programs. So Svitlana, over to you, and thank you so much for joining us.
Thank you, Martin. I will present a consolidated view and a few highlights of Ukraine's successful polio outbreak response. For a context, Ukraine had 2 polio cases in the end of 2021, 2 symptomatic cases and 19 non-symptomatic ones. So it called for a very rapid mobilization of resources to counter the outbreak. And while just shortly after the outbreak started, the war had started. So Ukraine had to halt the outbreak in a very challenging condition with a lot of disruptions, distractions, low resources and strained health system, massive population movement, and disruptions to cold chain supplies. Nevertheless, outbreak was considered over in September 2023, and there are a few learnings that I would like to share in the context of trust building. So first of all, it should be mentioned that 2 initial symptomatic polio cases drove from, one was from religious community and another was in a community of people living in a relatively closed settings together. And both kids were not vaccinated. So it required to actually be working with these communities. What Ukraine did, apart from mobilization at all levels, was to go and actually work with religious leaders, because it was identified that in some religious structures there was a promoted narrative of anti-vaccination. So these religious leaders, they were brought to public. They were also brought to public together with regional CDCs. They were brought under camera, and with an intention to be committing, to be working together on promoting vaccination. And people, when they are on the spotlight, it does bring them to some certain form of accountability. Next, in terms of working with communities that lived in a closed setting together, there was a collaboration between Ministry of Health and UNICEF WASH cluster. So in order to incentivize vaccine uptake, this community were reached with hygiene kits, and also it promoted the to be reaching out, taking vaccine, and vaccines were also brought closer to the people. There were vaccination buses, so that would also build trust to actually see vaccines close, making it horizontal. Important also, Ukraine introduced a 3-sectoral collaboration of Ministry of Health, Ministry of Education, and as well as it actively collaborated with a religious community, with Association of Churches. Next, it was important to actually enlist vaccination advocates, and in our case, it was parents, because parents are really the ones that are the most interested in the health and wealth of their children. So there were parents' communities, there were parent advocates that brought and further spread the information about vaccine safety and availability in their communities, and it was successful. Importantly, communication-wise, there was also a UNICEF study that analyzed nationwide the attitudes to vaccination and tried to understand what Ukrainians trusted to the most in terms of obtaining information about health. The study found that the most reliable and trusted actor for Ukrainian parents was a general practitioner. So they also actively worked with general practitioners for vaccine communication, and it worked very well. Media space, speaking of, unfortunately, we also witnessed troll farms that spread vaccine disinformation in social media, and it looked like it was sponsored by other countries. So that was important to spot. It was also important to introduce the monitoring, active, proactive monitoring of media space, of social media space, and to be coming and countering the narratives that were promoted. So it was important to do it at the regional level as well. And as a next step, Ukraine would further activate its work of communication training for the regional leaders, the crisis communication and so on. So that had to come fast. The action had to come fast, proactively, and it stimulates trust. And lastly, I would also want to highlight the difficulty of bringing vaccination into the Ukraine's agenda, because now with the immediate risk of shelling, it's difficult to plan long term. So it was important to understand how to bring it back, so people still go and vaccinate their kid. And they highlighted the importance of Ukraine reconstruction and Ukraine recovery, so that also worked. So to conclude, very horizontal, very collaborative, empathic, and simple messages and working together is what stimulated the work and trust in the system. Thank you.
Svitlana, thank you so much. That was great. And so now my pleasure to introduce Sheena Cruickshank, who is at the University of Manchester, and as I said, is a member of Independent SAGE. Sheena is an immunologist and professor of biomedical sciences, and crucially for our purposes, public engagement. And she joined us in Independent SAGE in 2022. Sheena, over to you.
Thank you, Martin. Thank you for the very kind introduction, and thank you for the invitation. So I thought what I would do is I'd start to sort of tell you a little bit about my background before I move on to discuss Independent SAGE. So as Martin said, I'm an immunologist, and I've always involved the public in my research, and I believe very strongly in the value of being open and sharing research in accessible ways. So when the COVID pandemic started, like many others, I did want to sort of try and help. I had children at home, and as a science communicator, I felt that that was probably the best way I could contribute. And I'd also built up quite a good network of colleagues in similar fields, primarily immunology or infection research via my fellowship with the American Association for the Advancement of Sciences and my work with the British Society for Immunology. So kind of working with those sort of two groups of people, and I was also part of the UK COVID Immunology Consortium researching immunology and COVID. I did what I could to try and kind of debunk what was happening, the kind of assault of information and new publications, varying quality that we were getting in preprints. So I did a lot of media commentary, articles in the conversation, a lot of social media. I also did some activities that were quite challenging, like Ask Me Anything on Reddit. And as Martin said, I wasn't initially a part of Independent SAGE, and they're an incredible group of interdisciplinary sort of scientists and researchers, and they came together to engage the public with up-to-date and transparent scientific information. What I describe now is summarized in our paper that kind of was published earlier this year, and it kind of documents our journey. It's called Independent Sage, an example of effective public dialogue and scientific research. And I think it's still open access on Nature Protocols. So in the UK, we had this kind of maxim, scientists advise, ministers decide. It was much repeated, but it was quite a tricky term, really, because it didn't really sort of give you a firm distinction between science and policy. And it also ignored the implementation of research is itself a kind of political issue, as we're sort of seeing in countries like America at the moment. And it also left the kind of phrase as to who and what science was actually being followed. Certainly for the immunology community, we had a great deal of concern at early ideas that were being posited about kind of doing herd immunity by infection without vaccination. So we were worried that there wasn't an immunology voice there. The UK government policy drew most directly on input from the official UK government Scientific Advisory Group for Emergencies, or SAGE. But the membership of this group and its subgroups were initially not public. And this was leaving a real kind of information void. We really didn't understand as the public what was driving decision making in 2020. And there was a sort of perceived lack of openness and honesty over uncertainty. And as I've alluded to, I experienced it, I'm sure we all experienced it, there was absolutely overwhelming amount of scientific information coming out, circulating on social media. There was preprints, peer-reviewed articles, even press releases sometimes. And these were of varying quality, and often this was finding its way into the public, confusing people, upsetting people, worrying people, and there wasn't enough context. And I think all of these events sort of triggered that inaugural lineup of Independent Sage, which I think was on the 4th of May in 2020. And from mid-June, they then committed to weekly 1-hour briefings that were live streamed every Friday lunchtime. And they had quite a structured format that kind of evolved. So they would present the kind of statistics, the numbers, the latest data and trends, but give some kind of values and interpretation of what that kind of meant for people. And then they would have specialist topic of the week. So it would usually have guests come in and talk to that topic. So it might be, for example, on inequalities. And we would have live questions from the audience. And this was submitted by a very broad range of people. I'm sorry, there's a practice fire alarm happening in the background. The membership was entirely voluntary and it was unpaid. So everybody was doing this in addition to their day job. And I think a crucial partnership of this was the fact that we had independent journalists involved with us at the start, the citizens. They played an absolute critical role in managing the comms, fielding public questions, and kind of helping us be a little bit more professional in how we presented. Over time, the aim of Independent Sage became clear about scrutinizing and communicating the best available scientific evidence, listening to experiences, concerns, and perspectives of diverse members of our public, and putting these together in ways that would support those faced with difficult decisions. The group also produced numerous written outputs that were shared on our website, which include downloadable reports, policy recommendations, short statements and emerging topics, fact sheets, visualizations, and even a collection of short format myth-busting videos about common myths that were circulating. And like me, we all contributed to the press and social media as well.
I'm conscious of time, so I think what we may need to do is come back to this in the discussion. I know this is a very, very packed webinar, but I think that was great in giving an overview. And also I see that Erica has put the links to our work and particularly to the Nature Protocols paper into the chat. But thank you very much, and we will come back to you in the discussion. So we now move on to the initial part of the discussion, and it's a great pleasure to welcome my colleague Yuxi Wang, who is she's a Marie Sklodowska-Curie postdoctoral fellow at the Institut National d'études démographiques in Paris. and previously worked at Bocconi University in Milan, where we worked together on the systematic review that Yuxi led, and also worked with us, in fact, with a number of people on independent stage in a paper in the BMJ. So Yuxi, over to you for your observations on what you've heard so far.
Thanks, Martin, and thanks so much for the great speakers. As a discussant coming from more of a social science background, I'd just like to tie some of the ideas and the cases together today by exploring one of the kind of more fundamental question, which is why the health myths and disinformation are so prevalent. And from my reading of the literature and my research and kind of summarizing the previous speaker, it kind of has to do with the fact that misinformation really preys on not only our minds, but also the system. And I wanted to kind of briefly unpack this dual challenge and to possibly provide some pathway to resilience through trust. So as Rachel has pointed out, brilliantly, trust in the health system is under siege. And misinformation, really, they thrive on human vulnerabilities and primarily through our cognitive biases. And it has kind of long been shown by social psychologists how confirmation bias and cognitive dissonance, they lead us to kind of reject facts that clash with our own beliefs. And then we tend to seek comfortable narratives that kind of align with our own emotions. So in a systematic review written together with Martin a few years ago, before COVID, way before COVID, we highlighted that misinformation really just not about the content, the false content itself, because there's always been false content around throughout history, but it's more about how more and more so that the content itself taps into our pre-existing fears and identities and worldviews. And when science really challenges these deeply held beliefs, our brain often chooses emotion over evidence. So what we need to do also in the public health sector is try to understand or look into the sort of emotional determinant of health, and not so much to suppress the emotion, but to kind of understand why people make certain health decisions and try to inspire hope instead of fear. And the problem with misinformation is not just a human psychology problem, it's also like a structural crisis at the moment, because the social media algorithm, they amplify sensationalism, they prioritize engagement, they polarize over truth. And during the COVID period with Martin and the BMG paper, we've investigated how several kind of interest groups were running active measures on social media to go against the public health initiatives. And we also saw how tech companies, they kind of sidestepped accountability and they're leaving the public health system to clean up the fallout. Now, with Meta also dismantling the fact-checking and the shift in political landscape, we are faced really with like even more dangerous era where the technology engineers politics and politics weaponizes technology to control the society. And also this applies to the health sector. But there is hope, as Svitlana has shared, that the Ukraine's case of the polio really is a great case of resilience, because in the chaos, the health official, they prioritize transparent communication, and by partnering with local leaders and GPs, they dispel the myths in real time, and in order to achieve the high vaccine uptake. And this means that even during crisis period, the trust through the health worker can win over any type of misinformation coming from the other side of the border. So this is the same with, I guess, initiative like the independent stage. So how do we really scale up this type of resilience in the long term? And I wanted to bring up Finland as a case because they are really one of the first to integrate media literacy into education. They're basically teaching elementary school kids to dissect disinformation tactics like scam spotting, and cultivating kind of even a new generation of, you can say, critical thinkers, but at least misinformation aware individuals. And this type of mental inoculation really trains the youth to question narratives, to recognize emotional manipulation, and to demand real scientific evidence. And of course, the individual resilience isn't enough. We kind of also have to reimagine our digital ecosystem, like algorithms that prioritize public interest, platform accountability for harm, and different type of digital policy that bridge the gaps of generations. So this also, of course, requires collaboration from the government, tech leaders, health tech workers, and with the shared goal of designing an ecosystem that serve information ecosystem serve the people and not profit. That's it. Thank you.
The challenges of us all being in different countries. So Erica, you've been monitoring. Thank you, Yuxi. Erica, you've been monitoring the chat and the questions. Do you want to pull together some of the themes, and we can? Should we get the panelists to put their cameras on at this point so we can bring them in as appropriate?
Yes, if everybody turns on their cameras, the chat box has been incredibly lively. It's been really engaging questions in there. I'm just going to group together a few, and then hopefully we'll be able to get to a second round. So please do keep your questions coming in. But some really quite big fundamental questions like, how much do information asymmetries in healthcare make it more prone as an area to disinformation, misinformation? And can these information asymmetries be addressed? Another question was, advice. What works in tackling disinformation, misinformation? We've had the example of Finland. We've got the example of UK and Ukraine. But is there anything else we should be bearing in mind? How do we implement policies to tackle misinformation, disinformation in countries on increasingly authoritarian paths? Which is a key consideration in some countries. And how important is managing expectations in building trust in healthcare? So I'll come back with another round after this. Thank you very much.
Okay, well, who would like to start on those? Anybody want to talk about the asymmetry of information? I mean, that takes us back to Kenneth Arrow's seminal paper, Uncertainty and the Welfare Economics of American Medicine, back in 1963, which contributed to his Nobel Prize in Economics. And this is a classic challenge that we face, and is the argument for a degree of regulation in medicine. Anybody want to look at that? Or Yuxi, do I see you?
Well, yeah, I guess there's a problem with when scientific evidence are generated, there's often some sort of debates over over the new evidence, and there will be information voids that allow misinformation and disinformation to fill the space. And this often in this kind of crisis period, it constitutes an infodemic, as in people are speculating, all kind of people jumping with their own opinions. And to solve this kind of, I think because in times of crisis, the fear and anxiety they take over in people's reaction to a crisis. So how to manage this type of fear and this type of psychology during the crisis is how to communicate in a way that has empathy, at the same time address the scientific evidence, but that in a clear and a simple fashion, I think is one of the key problem that we should tackle, the public health communication.
So there was thanks very much. There was a question about the trust and disinformation and so on in non-democratic regimes, and clearly that is becoming more and more of a challenge, even in regimes that appear to be democratic. And I just wondered if people have thoughts on that. I mean, Svitlana, you did actually allude to this with some of the challenges that you're having to confront in Ukraine. Not that we're saying that Ukraine is the issue, it's the information coming from elsewhere. So I just wondered if you had any reflections on that. Svitlana?
Yes, I'm thinking about regimes. I still think sometimes it's appealing to democratic regimes are not necessarily inefficient. It's difficult to admit, but it is true. And in my work experience internationally, I saw that if scientific community gets access to people who are in decision making, there are high chances of actually passing the message through them, And if the message is passed very well, it can really work well on the population. So it's not necessarily a matter of regime. It's a matter of actually reaching the decision maker. I would think that that is the difficult one to be able to talk to them.
And we had a question about the best practices. Now, Yuxi, you've already alluded to this in Finland, and I think all of us are looking toward at what is happening in schools there, where young people are being made aware of the risks of disinformation online and from other sources. But are there other examples of good practice? I wonder here, I might come back to Sheena, because I know that you didn't really get a chance to pick up on the take-home messages from Independent Sage, and you might want to say something about that.
Yeah, sure. I mean, I love what they're doing in Finland. I think that's a great way, because I think to tackle disinformation, you need grassroots things as well as at the top. And there's an awful lot of power in what's happening within communities and working with those. And Svitlana, I think you talked very nicely about how working with religious leaders was really important. So getting to people, you know, or talking with people in trusted environments and with trusted people. So in terms of Independent Sage, I think we had a few sort of take homes. Being interdisciplinary was really useful because it made us look at things from a broad perspective, addressing inequalities, involving the public with their interactions, supporting advocacy and interest groups. I think that's really important. All those grassroots organizations that are doing fabulous work and using lots and lots of communication channels and being very, very open about what we know, what we don't know, and what the uncertainties are, I think are some of the take-homes. There's more in the paper.
Great, thanks. Rachel, any thoughts on the work that you did in the book of particular good practices that you'd like to highlight?
Thanks, Martin. And I think Sheena drove it home of engaging stakeholders and engaging different voices to be heard, and in forums and in ways that are actually empowering and lowering power dynamics and differentials. And part of that is then fostering that trust, because it's so easy to misinterpret that trust in government is the same as trust in health systems, and it's not. And so government needs to also be armed then with ways of approaching the community and listening to the voices that need to be heard in meaningful ways, and being able to actually show and be transparent about that process and have that accountability. So I think that Sheena has really driven an important point home of best practices that can be exemplified across many domains of government needs to be held accountable to best practices in social participation.
I might just link it to something that came up in the chat earlier, which was the role of the humanities, because this is something I'm particularly interested in. I've written about it. I'll put a link in the chat later, where I've been interviewing in a series of podcasts. The title is Inspiring Doctors. You can get it on Spotify, all the usual podcast platforms, where I've been looking at doctors in particular who have found other media for communicating, newspaper columns, novels, a specialist in gastroenterology who won the television program MasterChef and has written cookery books with the science of food in them. And so on. Of course, this is a long tradition going back to Chekhov and Somerset Maugham and many other medics. And of course, there are other health professionals. So I just flag up that I think looking at these alternative mechanisms, television programs, one of the ones we have in the UK called Call the Midwife, and in the podcast series I talked to the actor who is the doctor in that, and his wife, in fact, who is the screenwriter. So I think the humanities play a crucial role there. But Erica, take us through the next round of questions.
Yes, sorry, even more questions are coming in as I'm speaking. Please do keep them coming in. Hopefully we'll get to a third round. But quick round of questions. Is there a role for the European Union in tackling disinformation, misinformation? Is there a role for them in investing in health literacy and infodemic management? Building on from that is how are we going to promote collaboration in this space? Collaboration between different organizations to stop us working in silos. How can we measure health literacy? How do we know what we're doing is actually working and having a positive impact? And And this is probably one for Martin, but is there scope for deliberative democracy for building trust? Okay, so back over to you, and I'm going to keep in the chat box making notes.
Okay, well, there's a lot to unpack there. The European Union, anybody particularly want to, I mean, I've got thoughts on that because clearly this is going to be a huge issue because the European Union is pushing forward with its restrictions, with its policy on the digital environment and artificial intelligence, but also social media, and is clearly about to get into an enormous battle with the United States, where some of the people who are heavily invested in these technologies are taking a very different view. So I think there's and the UK, of course, is also taking a different view, much more like the American approach. So I think that there are clearly issues there where I think many of us would feel that the European Union is ahead of the game, but we have no illusions about the threats that it will face because we know that the threat of tariffs are coming in due course. Does anybody else want to come in on that one?
My dad.
Okay, sorry, please, Svitlana. Yeah.
I was thinking how to measure trust. There are definitely novel approaches, but there are classical ones that are sociological, proper sociological research that can be commissioned to a sociological research group. As I mentioned, in Ukraine, UNICEF contracted a sociological research group to measure and to investigate who do we trust to get health information. So it's about getting a good sample, and it's about getting questions right. This is available. It's still working, and it's the best science.
Anybody want to come in on the deliberative democracy bit? Rachel, maybe? Where we're talking about citizens' assemblies and so on. I have to say, I have a conflict of interest as my oldest daughter is at the Institute for Government in the UK and has run several of these. So I could encourage you to Google Rebecca McKee, but that's a bit of nepotism, so which I'm sure I shouldn't really be engaging in, but she's written about that. But I think, Rachel, did you have any thoughts about that? Because you've looked at that too.
Thanks, Martin. And I think we've seen citizens' assemblies work across a number of different domains, but in more targeted, specific examples of the bioethics in France, speaking around cancer, but with trust, and then kind of, as Svitlana had mentioned, that it's difficult to measure and understand, and it is quite a complex concept. And so whether citizens' assemblies can engage and foster more trust through the process rather than the actual outcome, or an ongoing challenge of the citizen assembly is ensuring that people are, and maybe that would speak to the health literacy of having a firm base to have literacy be developed and disseminated in a way that is meaningful for all parts of society and population, as the basis then for starting discussions around trust. And maybe this is where the Citizens Assembly might play a more important role.
Rich, I might stick with you because there are questions about measuring trust, which of course are covered in the book, and how we actually go about doing that. And a related question is about measuring health literacy. How do we actually know that? How do we capture those sort of things?
Thanks, Martin. So in the book we do speak about how trust is currently measured, and we use the Edelman Trust Barometer is kind of the leading authority on trust, and this is where they looked at trust in the health context, and particularly COVID-19. There's a survey done that we really focused on and spanning several countries with many different respondents, and just looking at how the pandemic had either increased or decreased trust in health systems. And so we've got the results in the book, and there's been several iterations thereafter. But in terms of then engaging and understanding trust as a tool for measurement for health literacy, I think that there's going to be maybe a better understanding of how the two work together, and health literacy now measures an understanding of different health concepts, but with trust kind of now breaking into the notion around health systems and people seeing its importance in its place, I am wondering whether there will be more of an emphasis around measurement. But maybe, Martin, I think you could also speak to where this movement is going around trust and the complexities that we've seen.
Yeah, and there are real challenges because, of course, there is the saying we quoted in the book, the old Dutch proverb, that trust around a tortoise imparts on a horse. So it takes time to build up, and we give examples of that. In fact, during the pandemic, we had regular monitoring of trust in institutions, in particular one in the United Kingdom, where a senior official did something that he shouldn't have done during the pandemic, and that led to a dramatic drop in trust in England, but not in Scotland, where the similar data were being monitored. Sheena, given your role as a professor of public engagement in science, have you any reflections on this issue of how you measure the success of your engagement?
I think we've heard some really good examples of how we measure it, and I think another aspect is thinking about whether people are coming to you, because it takes time to build trust, especially at that community level. You know, I work in quite a diverse community here in Greater Manchester, and it's taken me about, I think, 5 years to really be a trusted member of that community. And the more I've been there, so I think being there is part of it, the more people I feel comfortable to ask me questions and involve me in things and get me to help with things. And I think that's another sort of side of the metrics is what people want from you, because it's always two-way. And I think sometimes we forget that. We talk about giving information, and you have to get them to people to want to have that information in formats that's useful for them. And it can take time, unfortunately.
And then we had a question about getting everybody to work together, which is a real challenge, because I think particularly when we're dealing with disinformation, often one may need to work with groups that we in the health community are less used to working with, like the security services, for example, when you're getting the deliberate spread of disinformation, often linked to cyber attacks and things like that. Maybe this is a question for either, well, Yuxi, I know, has looked at this, or Svitlana, from the situation, from what's been going on in Ukraine. Maybe I'll start, Svitlana, with you, and Yuxi, I could maybe come back to you to see if you have any thoughts about who we need to bring together to address these issues.
Yeah, thank you. I think we should go as down as possible. And in the case of Ukraine, we did a collaboration with Ministry of Health, Ministry of Education, and the Association of Churches. That was novel because bringing a religious community to government structure is a work, but it proves to be effective. But then at the same time, they had to enlist also teachers to promote health education and community health workers. So that would be as low as that and as high as that. And well, in Ukraine's case, we also benefited a lot from external help, technically in terms of resources. So relying on global guidance and using the checklists and methods that are already established and developed by others. In case of polio, there is, for example, UNICEF communication handbooks that is globally applicable, is also a good practice. Instead of reinventing the wheel, and probably resources can be diverted to something more useful.
Great, thanks. Yuxi, I think in your systematic review, you identified the many motivations that people have for spreading disinformation. Just following from that, are there any thoughts about how we get all the key actors together to try and counteract it?
Yeah, so from practically, I think to have kind of create in an emergency setting, a kind of a cross-sector task force that combines different ministries, different actors, government agencies, to kind of give, for example, workshop on media literacy for all kind of demographic groups, because people, different populations, subpopulation have different literacy, and how to make them be aware of let's say to make people understand the message's agenda, the analysis of the narrative, being able to understand what are the tactics that the messages are using is important for people to kind of understand what information is more fact-based and what is not. And another thing is to, I guess, try to introduce a legal system that, if we would count that, to make a platform that have caused harm or accountable for whatever that is related to the algorithm that generated to spread the type of disinformation. But that is something that's way beyond our current capability, and also we need to have also government-funded independent research that investigate exactly the outcome of some of these misinformation spread. Yeah.
But I think certainly looking at what the European Union is doing in digital services is going to be crucial in this. We've got a few minutes left. Erica, one or two last questions. We'll see if we can pick them up quickly before we finish in the next minute or so.
Okay, so two quick questions. One, how is trust harmed if the public believes health system staff are primarily self-interested? So particularly in profit motive in health systems. But also, do we just need to be better storytellers? Do we need to just be better at communicating? Over to you.
Okay, very quick. From anybody who wants to come in any of those, we've got about 1.5 minutes left. So quick fire answers.
Yes, I think the role of doctors and health givers can be very important in trust and perceptions that they are not trusted. And equally, that can be played on, and some notable medics or ex-medics have played on their credentials to be able to give messages that are not truthful, and then they make money from it, and they're quite quiet about the fact that they're making money from it. So yes, I think that's very important. I've forgotten the other question now.
Well, I think Yuxi, I think you've been looking at this too. The issue of trust in health professionals.
Yes. Yes. The fact that, I guess, the narrative, the conversation between the patient and the doctor, it's a very like rational discussion in general. But I think there is something that we can try to install a bit more a personal story in the communication when there is more emotional engagement and resonance when a patient is communicating with the doctor. Maybe the trust part would be this is actually in China, it's a huge problem because the massive amount of patient that goes into a hospital, there's always some sort of tension. So being able to have more empathy in the conversation also helps. Yes.
So I think we all need to be better storytellers. I think that was one of the points there. So I think we have run out of time. Am I right? And with that, can I just say thank you very much to all of our panelists. I think that was a very good session. And you can register, you can keep an eye on the future webinars. Anything you want to add, Erica, for what's coming next?
Yes, I look forward to seeing you all next week. We're going to be introducing the Observatory's new health reform tracker. So yeah, another way of getting evidence into policy making. So looking forward to seeing you all next week. Okay.
And on that, thank you all very much indeed for all of your many contributions. Thank you.